Oh, welcome to another live session, the last one for this week. Yeah, so it's already Friday. Very quickly, the day just flies when we are right in front of you. So, how are things with you? How are you all? What are you all up to? Are you all thrilled like what we are to come in front of you and have another thrilling live session with me, Vinod James? With, of course, you are watching the live from Neethu's Academy. Yes. So eagerly waiting for all your lovely messages to pop up. So as the messages are popping up, simply some message or good afternoon always there, isn't it? There are very few names which always are there at the very first thing that they will do. They comment. Priya Prince Biju, good afternoon. Priya Sunil Kumar, good afternoon. Atila Shashi, good afternoon. Sanila Saifal, good afternoon. Very, very, very good afternoon to all of you. Drishyanathan, good afternoon. Right. See, few things to bring to your attention, okay? See, when you're learning, okay, it's what is important is so you always have to be ready for changes. Divya February, good afternoon. Because why I'm telling you this is I really found that students are not able to gain, like what can I say? That changes that is needed. See, you have to, Jitin, good afternoon. See, you always have to be ready for open approaches. Okay, that's very, very important when you're learning. Rinchu and Abraham, good afternoon. Neeraja, good afternoon. Vijimol, good afternoon. See, why I'm telling Soumya Shiju, I'm very happy when you call out my name, so it's motivation to answer. Always, as I've always promised, I will definitely call out everyone's name. So as long as you are happy, we are all happy. Good enough. See, this is what we love about all of you is see whatever that you feel you're letting us know. See, that is also another motivating factor for us, isn't it? What you feel and how you feel about what when you come in front of us, and that's called the give and take policy. Okay. So please feel free to comment whatever that you feel. Give out your suggestions. We are all ready to mold accordingly. Merinumman, good afternoon. Ningmi Jensen, good afternoon. Anuanil, good afternoon. Now, why I was talking about the changes. See, in life, you always have to be ready for changes, okay? Especially when you're learning. Anuanil, good afternoon. Ansu Varghese, good afternoon. Meera Varghese, good afternoon. Jessa Noble, good afternoon. See, why you can't be rigid. See, please do understand how you have to take this. Lintu, good afternoon. Honey, Kalapurekal, good afternoon. Anaga News, good afternoon. Ambilijinu, good afternoon. Sonu Priya, good afternoon. A very good afternoon to all of you. Now coming back to the change. See, when you find that somebody have told you about a change, okay? See, Jean Maria, good afternoon. Nino Alex, good afternoon. Always with that flag. Thank you very much. See, you have to always think, okay, try it out. See, don't be adamant. Okay, see, when somebody tells you, okay, no, this is the way. Somebody in the sense, don't go for all the other people who are talking about when it's a genuine way and it's have come out well after a trial. Please do. Subiraj, good afternoon. Jinsi Matthew, good afternoon. Shinu Alfonso Joseph, good afternoon. See, when let's say you're gone to a class to learn something, okay? Let's say the faculty member is telling you certain thing. Okay, this is what you do. Don't simply sit saying that, no, I won't do. You try it out. See, first and the foremost important thing is there is nowhere that they would advise a student to go into a wrong track until and unless it is the fraudulent people that is available. Okay, Manju Shavani Krishnan, good afternoon. Grishma Raj, good afternoon. Vinita Renu, good afternoon. See, when it's a professional way of dealing, please understand this is how you have to understand. See, when somebody tells you to change, okay, or somebody tells you, okay, this is the way that you can enhance yourself. See, do that because they have tried and tested those strategy, and that we will see when I tell certain students, they find it. See, I'm telling you seriously because This is something that I always experience. So I want to make sure that you are not doing the same thing, because all of you are here for the betterment of your life. Rini Georgie, good afternoon. Donna Anish, good afternoon. See, when somebody tells you, okay, this is what you have to do, see, do that and see. Okay, don't take it lightly, because generally students are taking it very lightly. See, don't think that, okay, because you are at the comfort zone of where you are, that doesn't mean that that will be the same thing that you will experience on the day of exam. So you have to know that. See, when somebody tells you to do certain thing, that is for a particular reason. Okay, so be ready for that change. You have to. See, when we say together only we can crack it, that's the only way to crack it. Okay, and that's why I love about the caption that we have created is together we can crack it. Because it's not at all one way, or I cannot make you do until you are ready to do that. Okay, there are things that you have to understand. So El Shiva, good afternoon, lot of known names. So please be aware of it. And when you are done, see, let's say, when you are sure, sir, will follow the instruction. Merin, thank you very much. You know, it's something that I generally wanted to make sure that it's not just our advice. Okay, please do not think that it's only what I tell. See, when you are, it's generally because I always want to make sure that from what I have learned, I will always come and tell you. And that is what Neethu's Academy is always into. See, whatever that we have incorporated into is after a lot of trial and error method. See, we are not saying that we haven't made errors, but of course we learn from that. See, learning is a process where you learn from your mistakes, and you have to learn from your mistakes. Understand? See, when a student comes and tells, yeah, it is difficult, I won't do. Do you think that is going to aid them to be better? No. See, you have to start telling yourself, okay, see, a person is telling, okay, this is what it is, and they have the substantiated, let's say, and proof saying that, okay, this is what they have done, and this is how they have enhanced all the other students. Be happy with that, isn't it? Understand, don't think that, okay, whatever I think is right, yeah, you can do that. I'm not saying no. Reshmi Vinesh, good afternoon. El Shiba, yes, okay. Thank you for all the support that you're saying. Please be ready for the change and try it out. First and the foremost important thing is, when somebody tells you something, incorporate it and see whether it is working for you, because you are individuals. Everybody have different pros and cons. Your pros should be made as your strength, your cons should be, you try to eliminate those cons as well. Don't just say, I have this. Let's say I'll tell you one common thing that they students come up with. Reading is difficult. Of course. Understood. Now what are you doing to enhance it? I don't do anything. Now do you think that it will be enhanced? It will not. Understand? See, when you say something is difficult, okay, fair enough. You have, be happy with that you have realized that, okay, there is some difficulty in reading. Now what are you doing to enhance it? How are you enhancing it? That is where we come from. We come and tell you, okay, see, you have a problem like this, do this. And then you are saying, no, I don't do. Then do you think that it is going to enhance? No. Understand? See, the most important change that a student can bring into their strategy or into their life, into the way that they study, is by yourself only. We have a certain role. Okay, we can come and tell you, but if you don't do, generally that is how it is. Because, and there is a time that you will realize that, but see, at that time, will it be late is the next question. So it's always sooner. See, one and foremost important thing. Now my next question is, now let me give you an insight on the aspect. Just imagine, do you think that let's say the exams are only that what you're going to write only before you reach your dream country? No, every day is going to have an exam in front of you. See, exams are going to come one after the other in front of you, and you have to start telling yourself, you are people who have already jumped over all the major exams. So this is also another exam, I will jump over. Another exam, I'll jump over. But the strategy that you have to adapt would be a bit different. You have to start being adaptive. not rigid. Merin says good afternoon. Okay, so this is just a suggestion, okay, because I thought I'll have to tell this one day, because you have to be that change in you, to feel that change, to experience that change. You have to change. Neethu Binoy, good afternoon. Swapna Mul Matthew, good afternoon. Anju Davis says, sure, this is what I, again, that whenever you give them, give you, not give them, sorry, give all of you some suggestion, you are able to take it on the right way. It's an absolute good thing, isn't it? Shruti Vijay, good afternoon. So, are you all ready for the last live session of this week? Yes? If so, let me see how many of you are ready. Give me a thumbs up. Roshni Mariam, good afternoon. Roshan Mariam, sorry. How many of you are ready? Let me see. And lots of new names. Anybody who's attending for the very first time, please do let me know as well, yeah? Where are you from? That's more important. Neeraja is ready. Very good. The first person to reply. Good, good, good. I could see that few thumbs ups are going. Ambali is ready. Very nice. Priya Kumar is ready. Good enough. Rashmi Vinish is ready. Okay, excellent. Adiraja is ready. Good. Sanila is ready. Very, very good. Okay, see, I want all of your active participation, because Desna Noble is ready. Neenu Alex is ready. Very good. All right. So as you have started saying ready, and I expect more participation. Yeah, Soumya Shitu is ready. Jean Maria is ready. Excellent. Shruti Vijay is ready. So you have to start telling. I told you yesterday, because I don't want to repeat the same thing over and over again. The importance of validating your presence. Princip is ready. Anu Anil is ready. So what are we going to do? See, we always do. Neenu Alex is ready. We always do two things. One, we'll be talking about a part A, which I've already shared, and the other one is a part B. So part B, Neethu Binoy is ready. Rini Georgie is ready. Okay, new names as well, but still nobody have told me that you're new. Donna Annie is ready. Shija, good afternoon. So the part A, sorry, the Jubi and Jobi, I'm ready. Very good. Marin ready. Okay. So please look into once the part B question pops up, you'll have only 2 minutes. Yeah. Drishyan is then ready. Good afternoon, Neethu. Meera Givergi is ready. So once that time, you have to start pushing yourself. See, be active enough in doing. Okay. Don't have that lazy attitude. Okay, I am at home. I will take slowly. No. As soon as it is popping, you start looking into it. Find an answer. Be ready. Then once don't write the answers, I'll ask you when to write it. Yeah. So these are few things that I want you to always understand. Every time when you're doing a material, you should always tell, Jobi, I'm new. I was going to ask. Thank you very much, Jobi. Where are you from? If you could tell me. Anju Davis is ready. See, the whole thing is to make sure that I keep on feeling more pride in my my known people's list. I have people across, if you really look into, I have people from all over Middle East. I have people from Australia, New Zealand, Ireland, UK, Maldives. I have people from Israel, South Africa, other parts of Africa. Vinci Jobin, good afternoon. Across India, to be very precise, even Nepal. So I'm from Delhi. Okay, I had a lot of students from Delhi as well. So I keep on adding another known person from Delhi. Good enough. So what Neethu's Academy is, see, we have two things. One, we have a regular batch, and as you can see that we are full till May. Our next batch is starting from June, July, August. So that's how much of a trust that our students are having. And then we have crash courses available. If there is any doubt that you want to be clarifying, please do contact our admin number. We will not contact you, and we only have 2 Telegram group. Again, I'm reminding 2 Telegram group. One we have pinned, that is the official Neethus Academy page, and the other one is an exclusive reading Telegram page. Both are free, but what we do is to get yourself into the reading Telegram group, we double check, we scrutinize it. Okay, because we want to avoid these fraudulent people. And do not reply for any like let's say somebody whom you don't know, because we will not send you message. Okay, so do not reply to any people. I tried to call you, you contact me, and those kind of things, don't. So as you have said, you are ready. Now, no sooner a question will be popping on the screen. please do the question as with the intention of, okay, this is the material that I'm going to do on the day of exam. All right, so that should be the intensity. That should be the feel. See, whatever that you are doing, please understand it is for you. There you have the question. Please do it and then we'll discuss. Okay. Time doesn't wait for anyone, isn't it? Good. So I hope all of you have had an answer or do have made your choice. Okay. Very good done, Shija. Okay, excellent. Now, can you all type what is your answer? And more precisely, where you got the answer. Manjudeva said done, excellent. Good enough. And I always love to see all these, marks which is there. There are some, most of them are with heart-shaped flags, hands. So please do, if you have not yet subscribed our channel, please do subscribe. Please do click the bell icon so that you will not miss any of the future updates. Please do like the page that you're watching. Please do follow us so that you will not miss again. And if you have not yet shared the very same link that you're watching, please do share it. So because we want to make sure that we reach to every needed people across. So in the meantime, I miss the Lord of done. Ambili, Saumya, Jasna, Neenu, Anu, Atira, Elshiba, Priya, John C. And now I have Miragi Varghese, Anu Anil C, Miragi Varghese C, Ashwati Kiran, good evening. Liba Liban C, Shija C from whole para, Elshiba Elia C, Drishya C, Atira C, Jeet Maria C. Okay. C, Richu Anna Abraham C. All of you are saying C, is that? Ani Kalapurakil C, Roshan Mariam C. Neethu Binoy C from first two lines. All right. Nino Alex C from the whole para. Litty Philip C. Anju Devasya C from the last few lines. Jobia done. Okay, fair enough. Jobia Delhi. Okay. Just now I got C from whole para. Saumya Shijo in the first line and the last line also they insist to say that some life changes will help to manage hypertension. Okay, Ambali C from middle of the paragraph. Elshiba is in paragraph. Rensimole, now am I happy? I have another option to talk about. Rensimo Thomas A, Shruti Visual C, Elshiba C, first para, Elshiba only one para, no? Dona and C, I was just joking. I do understand what you meant. Pinukos A, Thomas Casey C, जो भी है C, first and last lines. Okay, now I have two people who are saying A and all the others who have commented are saying it is C. Okay, fair enough. Let's see who is right, whether the minority, the majority, or the null. That means none of you have told me B also. So, Rini Joji, now you have changed the answers, is it? See, now I thought you said A before. Don't change your answers if you are doing. Okay, that's not right. Swapna Mol Matthew. See, stick to always another suggestion for all of you. Stick to your first answer. Now, let's see. Now, when you're doing part B, the first and the foremost important that you have to always remember is do not read the paragraph, that is just to manage time. Read the question. Please read the question. As you're reading the question, you are supposed to underline the keywords of the question. Okay, now the question is very simple. What is correct about hypertension? You all know hypertension. So what is correct from the given paragraph is what you're asked to, okay? No, sir, I didn't change. Rini, I'm very sorry. I thought somebody else because I can't remember who told me first A. Yeah? Sorry for that. After that, you have two options. One, you can read the paragraph and then pick an answer from the three options. Or if you're like me, read the answer option, underline the keywords in the answer option, then pick it up from the passage. Anything is fine. The paragraph will be shown no sooner. Okay, as I'm going to say, what is correct? So the question is very simple. You are expected to find something out of the given one is correct. Now, what is that? Okay, and always remember, see, part B is about paraphrased answers. They will never give you answers as straight. Okay, and you are expected to understand the gist about it. Okay, now as the question says, option A, for subjects with normal, subnormal hypertension, it can prevent or delay hypertension. Okay, now that means for subjects, that means for patients with normal hypertension or subnormal hypertension, it can prevent or delay hypertension. Now that is option A. Option B, BP can be well tackled with the use of BP specific medicines. So BP tackled medicine. Option C, which has the majority, right changes in lifestyle can curtail down BP values more effectively than various other medicinal therapies. Okay, now right changes curtail more effectively other medicinal therapy. So it's a comparison between, okay, when you make these lifestyle changes, it is more better than the therapies is what they're talking about. Now let's go into the passage. Now I'm clear about what are the three options. Now I'm going to read. Hypertension, prevention or treatment. Okay, they're asking whether it is to prevent or is it to do the treatment. Okay, now this is where you have to start. Now reading is such a kind of skill. You have to start imagining things. That's what the most beautiful thing about reading is. You will enhance a more lively kind of thing, whatever that you would want to make it into. Okay. Now, let's read the paragraph. Adequate changes in lifestyle are the cornerstone for prevention and treatment of hypertension. So very specifically saying adequate changes in lifestyle are the cornerstone. Cornerstone means something of great importance, okay, for the prevention and treatment of hypertension. So adequate changes means, see, adequate means, it's another thing that means madhyaya. Okay, that's where the adequate changes are. Although rapid medical initiation is necessary for the patient in a high level of risk. Now they are coming with the word called although. They're saying yes, adequate changes in lifestyle is the cornerstone. Yes, it is important. But although these kind of cohesive devices you should always look into, although they're very specifically saying rapid medical initiation. Initiation means the action of beginning. So that means to start, arambam is necessary if the patient is high level of risk. When the patient is at high level of risk, lifestyle changes are fundamental for the therapy. So there, they're referring to rapid medical intervention. Then lifestyle are fundamental. They're saying, yes, it is important. According to the previous report, now they're bringing up saying, according to the previous report, lowering effect for stable blood pressure can be equivalent to monotherapy of medicine. Now comes a problem. Okay? According to the previous report, what are they saying? Lowering effect for stable blood pressure can be equivalent. Equivalent means same, equal in value. For what? To monotherapy of medication. So now what are they saying? Lowering blood pressure is equal to monotherapy. So it is the same. Contrarily. Now contrarily means on the other hand. The weak point would be the low level of compliance or adherence associated with necessary time for adequate reaction. So are we giving adequate time for reaction? So they are all talking about the way that it is prevented and also the delay which is caused due to it. Adequate changes in lifestyle would be effective for some groups of subjects. Now they are saying adequate changes in lifestyle would be effective for only some group of subjects. So it's not applicable to all. Again, for grade 1 hypertensive patients, it can prevent or delay medical therapy. Okay, so for grade 1, they are saying it can prevent or delay medical therapy. Moreover, again, for hypertensive patient continuing on medical therapy, it can contribute to BP reduction of blood pressure and allow reduction of the number and doses of antihypertensive agents. That means that is you are consuming. Appropriate changes in lifestyle would decrease other cardiovascular risk factors and improve several clinical conditions. Okay, now let's see. For subjects with normal and subnormal hypertension, it can prevent or delay hypertension. So for patients with normal and abnormal, subnormal hypertension, it can prevent or delay. So for me, it is saying that only, although rapid medical necessary for patient in high level risk lifestyle changes are fundamental for therapy, according to the previous research, lowering effect of stable equivalent to monotherapy of medicine. Contrarily, weak point. So this is talking about the normal people, and the weak point should allow low level of compliance or adherence with the associated necessary time for adequate action. That means prevent or delay. The delay is also paraphrased there. Then, for me, slightly it is pointing into A. Okay, but I'm not confirming as what you have said. BP. Now let's go to the elimination method. BP can be well tackled with the use of BP specific medication. Nowhere in the paragraph it is talking anything about that. So it's an easy eliminator. Now to the option C, which most of you have told. Now what do you mean by right changes? Right changes means correct changes. Adequate means madhyaya allengil satisfactory or acceptable quality allengil quantity. So right changes and adequate changes are not the same, even in a paraphrase. Now that is where one point it is not sinking. Then right changes in lifestyle mean that they should be telling what are the changes that should be there. Are they telling any changes in here? What should be the changes? They are generally saying adequate change in lifestyle is fundamental. Okay, fair enough. What are the changes? Not there. Okay, that is one. Can curtail. Curtail means bring down, or let's say stop. BP value. BP value means the thing. And more effectively. Now this is the problem. Lifestyle changes are more effectively than various other medical therapies. Not there. More effectively is not there. See, they are saying It is adequate changes in lifestyle would be effective for some group of people. It's not the general categorization, and they are very specifically saying the other way around. For grade 1 hypertensive patient, it can prevent and delay medical therapy. Which one? Adequate changes in lifestyle, not right changes. Understood? So, moreover, hypertensive patient continuing on medical therapy, it can contribute to BP reduction, blood pressure, allowing the number of doses of antihypertensive agents. They are saying it can reduce the number. They are not saying it is more benefited effectively than others. No. Okay. Appropriate changes in lifestyle would decrease other cardiovascular disease factors and improve several other clinical conditions. So they are not saying that it will curtail, that means it will stop BP values more efficiently than various other medicinal therapies, is not mentioned. So unfortunately, today, it's the minority that have taken the right answer. So the answer for today is A. Because you went right changes, okay, adequate changes. No, right changes is not adequate changes. Then again, what? Curtail BP values. It's not going to stop those BP values. No. Curtail means that is how you should be looking into. Okay, and more effectively, that comparison is not there. Here they're talking whether it is prevention or treatment. Okay, but in the paragraph, they're only talking about for subjects with normal, subnormal. Where are they talking about subnormal? Weak point. That's where the other part comes. Prevent or delay. Delay is also mentioned as what? It will take adherence associated with the necessary time for adequate reaction. So that means the delay there. Understood? Anjudevasya, understood? Is there anything? Do not worry. See, what happens is, see, basically, there's a small confusion between students. That is what I have noticed. See, students are always looking into keywords for part B. If you look for keywords in part B, let me remind you, you will not get the answer. Understood? See, keywords are for part A, which we are going to do. Okay, Ambali is clear. Just not clear, Anjudev is here. Do not feel sad. See, that is why we are here, isn't it? This is why we want to make sure that we become the bridge between you. But of course, as I've mentioned, you have to come out of that comfort zone. See, that ideology have to change. See, when things goes different, you have to start looking into that also differently. Why are we saying? Why did that person say like that? Not people, okay? I'm talking about from the right, or let's say you call it like horse's mouth, isn't it? From the right person. That's how you have to take it. Right. Good enough as we have started saying clear. Now let's go into part A. Give me some insight about today's part A material. How did you feel? How many of you are going to get 20 out of 20? Let's see. Soumya clear, Swapna clear. Fair enough, Rinsimo. Congratulations, you appreciate it. It's always nice, you know, those kind of gestures that you do. Fair enough. What is today's material and how many of you are going to get 20 out of 20? It's first and the most important thing that I would definitely want to know. Chija, clear? Okay, fair enough. Because I know that it's a quite easy material today, Neethu madam. Well, that's what I felt, because all the answers was easily to be referred, except for one question which I liked it, because you have to have some thinking into it. Apart from that, everything is a quite straight answer. What is today's material? So today's material is ACL reconstruction, easy material. Fair enough. So as we have started saying easy, are you all ready with your pencil and your answers? Shall we go? Yes, I'm sure that we will go. Let's go into question number 1 to 7, which is massive following. What all things have to be carried out properly for fast healing? So very specifically, what carried out fast healing? Okay, so it's very specifically saying strengthening and range of motion exercise are started to early in the recovery period. So what are you to do? You are to do, oh, very good. I like Anju Davis is saying I will. Good enough. So the answer for question number 1 is C. Question number 2, treatment option that shouldn't be performed on babies. So very specifically, this shouldn't is a problem. Treatment shouldn't babies. So where are they talking about? If you really look into text D, the last point, it says not for use on infants. So the answer is D. This is where you refer keywords, yeah? Question 3. Where could we find a series of expert opinion, regarding the best management option for ACL tear? So where are they talking about different healthcare professionals? It's there in text A, psychiatrists, sports medicine, physician, orthopedic surgeons, along with the radiology and rehabilitation professionals, collaborate to determine the best treatment option. So the answer is A. Question 4. Remaking of ACL for the mending of a broken ACL is done through. So ACL, remaking, mending, broken ACL, if you really look into, is as such mentioned in text B. Next, the graft will be harvested, a section of the tendon from another part of the body to cut into graft, and all those things are detailed there. So the answer is B. Question 5. When can one get back to the field of sports once the surgery is done? So resume the sports activity. Where are they talking? It's there in text C. If you really look into the first sentence, will give you the answer. It usually takes 6 to 9 months for a patient to return participating. So the answer is C. Question 6. Important factors to be considered before administering any sort of therapy. So factors. Where did I underline factors? Okay, I've underlined factors in text D. So various factors for any sort of therapy. Factors are as such mentioned in the table there. So the answer is D. Question 7. The condition that probably evolves post to an ACL surgery. So post, you know what is post and pre, isn't it? So where are they talking about? Is as such mentioned, more likely to develop osteoarthritis in the knee earlier in life than those who do not. So the answer is A. So I have finished the 1 to 7. Please be kind enough to tell me what are your total scores. In the meantime, let's go into 8 to 14, which is called short answer question, where you're expected to write a word, a number, a combination of both, or a short phrase. What will be detached ultimately to ensure completion of the procedure? So detached, ultimately, completion procedure. So what are they talking about? They're talking about, in text B, the very last sentence of the paragraph, screws are used to secure the plugs of bone. Over time, these plugs will grow into the surrounding bone. Surgical instruments are removed to complete the procedure. So what is that for the completion? Surgical instruments. A two-word answer, SURGICAL INSTRUMENT. Absolutely stunning. I could see a lot of students are typing 7 out of 7. So happy. Question 9. The best and the appropriate measures to be taken by someone urgently post to a surgery is to step into a dash. So again, post, best, appropriate, urgently, surgery, step into. So what are they talking about? It's as such mentioned again in text C. Just below that, patients are able to walk with crutches and leg braces on the day of surgery. Very soon after surgery, patient enters a rehabilitation program to restore strength, stability, range of motion to the knee. So what are you to enter? You are to enter rehabilitation program. Again, a two-word answer, rehabilitation Excellent. Question 10. At what state may be patient if he or she shouldn't be treated with any form of devices? So what state would be in when there is nothing to be done? So the answer should be in text D. Devices should not be used while the patient is asleep. So what should be the patient be doing? Asleep. Very good. Asleep is the answer. Question 10. Other than an orthopedic surgeon, who are likely to perform the surgery on persons with a complete ACL tear. So complete ACL tear, the only, who is the other one? That R is a problem, yeah, that who is likely to, yeah. So the sports medicine physician, you get that from text A, complete ACL tear, that's the key word of the question, are usually treated by sports medicine physicians and orthopedic surgeon with an ACL reconstruction surgery. So sports medicine physician, a 3-word answer, SPORTS MEDICINE PHYSICIANS. So that is why the R is, okay, sorry, the R is there because physicians. Anyway, question 12. What is the contrasting factor that may witness between cold and heat therapy? So factor, cold, heat therapy. Now this is one answer where you would have been a bit thinking about, isn't it? That's where I also spent a bit of a time. So where are they talking about cold therapy, heat therapy, factor? So they're talking about all those therapies there. That means between. So previously apply heat. Yes, Jean Maria, the answer is effects. EFFECTS. Okay, very good. I was thinking that I think I was the only person who had the problem. All of you have got the right answer. Effects, yeah, it's not effect, Anu. EFFECTS in the table. Excellent. 13. The instrument used to deliver saline solution to expand the space around the joint. So what is the instrument? Deliver saline space joint. So they're clearly saying it is arthroscope in text B. The arthroscope is inserted into the knee and delivers saline solution to expand the space around the joint. Who are more, that means question 14, who are more prone to get injured by either a partial or complete ACL tear? So definitely ACL is something related to sports. So of course the answer is athletes. So the answer is there in the third sentence of part A, sorry, text A. A partial or completely torn ACL is a common injury among athletes. ATHLETES. See, please understand, it's not athletes, it's athletes. Okay, so you please pronounce it right, because you're all going to go to those kind of country where they'll come and say, oh, that athlete is good. Athlete, yeah, it's not athlete, athlete. Good enough. Now for the final stint of fill in the blanks. 15 to 20, a dash should properly supervise the rehabilitation period of the patient, followed by a proper follow-up appointment with surgeon. So dash should supervise rehabilitation surgeon. So who should do that? A physical therapist. Now where do you get this physical therapist? You get that from text C, the last paragraph. In order to achieve a successful outcome, it is critical that the patient have a rehabilitation period that is carefully supervised by an appropriate physical therapist. PHYSICALTHERAPIST. Question 16. Application of ice cold pack directly over the dash is not recommended as it's extremely cold. So application pack not recommended. So where are they talking about? Is as such mentioned where? In the skin. So ice cold is as such mentioned in the precaution, yeah. Ice cold packs are extremely cold and should not be applied directly to skin. So the answer there is skin, SKIN. Question 17. The dash consists of soft tissue structure called ACL that connects the femur to the tibia. So femur, tibia, soft tissue structure. So where are they talking? Is there in the second sentence of text A. The ACL is an important soft tissue structure in the knee that connects the femur to the tibia. So the only one which is missing is knee, KNEE. Question 18. The dash aids to anchor the graft as well as later develops into surrounding bone. So anchor, graft, develop, surrounding. So they're clearly saying in the very same place. You have already dealt that paragraph. You have already read that. So it's easy for you to refer. The answer is a section of tendon from another part of the body cut to create graft, which is then attached to the end of the plugs of the bone taken from the palate. And these plugs help to anchor the graft that will become the new ACL. So what is that? The answer is plugs, PLUGS. the penultimate one for this week. The surgeons evaluate structure that surround the torn ACL, including the left and right meniscus and the dash. So meniscus is a keyword, surgeon evaluate. So where are they talking about? The answer is just above that paragraph. Surgeons then evaluate structure that surround the torn ACL, including the left and the right meniscus and the articular cartilage. So again, a two-word answer. Articular-cartilage is the answer. The ultimate one for this week. Dash is the range of heat to be applied using a heating pad over the affected area for 15 to 20 minutes. Very specifically 15 to 20 minutes. Heating pad. Where are they talking about? Apply heating, bracket, heating pad, keyword is there. Low to medium heat. So what should be the low to medium heat is the range. So it's a three-word answer. LOWTOMEDIUM. So I have wrapped my 20. Now as you have all promised, how many of you have got 20 out of 20? I know that there are going to be a lot because most of the people have had right answers when you were typing. Okay, absolutely stunning. Good enough. Low to medium heat is not the answer. Low to medium, because heat is already there in the question. Liba 19, very good. Keep it up. Jessna Noble 20, absolutely good enough. Kept the word, isn't it? Good, good, good. How about others? Liba 9, yeah, I knew that it was a typo, so no problem. Jean Maria 19, good enough, excellent. Reshmi Vinny 17, good enough, keep it up. Josna 17, good enough, keep it up. Good, good. Anju Devasi has promised again 20 out of 20. Excellent. Ansu Varghese 20 out of 20. Very, very good. Keep it up. Good, good, good. So everything is happening for all of you, isn't it? Good. Priya Sunil Kumar 18. Good enough. Soumya Shiju 18. Good enough, good enough. Sanila 18. Good enough. Shruti Vijay 18. Good enough, good enough. Donna Anish 15. Good enough, good enough. Keep it up. Swapna Mal Matthew 18. Good enough, good enough. Excellent. Ramya Shivan, hi. Ramya, I'm sorry, I'm just going to wind it up because it's a bit too late, I think. Right, in general, is there anything that you want me to clarify? If so, please do comment. Is there anything that you want me to clarify for you? As I expected, you're all stunning students. All of you know what you're doing and what is needed. See, that is what I'm talking about. See, you have to know what is your need and then you adapt. The adaptive attitude should be there. You should have that rigid. I'm not saying no, but when you're learning, you should be able to. See, learning is a process where you learn from every part. Thank you so much. Happy weekend. Thank you very much, Soumya. Thank you so much for all those bouquets. Priya, thank you very much. Anju Devasi, thank you. So as you have started saying thank you, I wish all of you to have a super duper weekend. And I'm going to miss you all. Until I see you on Monday. Adios from all of us from Neethus family. Take care. God bless you.